Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Pharmacokinetics. The antihistaminics are well absorbed orally. They have high first pass metabolism is very high. They are short acting drugs, and because they are short acting drugs, they have a half life of 12 to 24 hours. Older generations, that is the first generation one, are lipid soluble, whereas the second generation one are water soluble. So these become ionized because they are water soluble. They become ionized at the physiological pH, and thus they do not cross the blood brain barrier, whereas first generation, because they are lipid soluble, they cross the blood brain barrier and result in CNS depression leading to sedation. But this side effect is not present for second generation antihistaminics. And the estimazole will achieve a steady state concentration in around 1 week, whereas these are not effective. Therefore, they are not effective in acute states. Then we have loratadine. Loratadine is a longer acting. It is actually longest acting is loratadine, and this loratadine has least entry to blood brain barrier. The pro drugs of antihistaminics are we have hydroxyzine, we have cetirizine. Prodrugs are hydroxyzine, cetirizine, terfenadine, and fexofenadine. Hydroxyzine, cetirizine, terfenadine, and fexofenadine are the prodrugs.
thank you and thank you for watching.